Many believe life as we know it has changed irrevocably, and that in this seismic shift lies an opportunity to turn things around, improve our world, and make life better for the majority, especially in poor countries. It is time to reboot Nigeria. This is Pivotal. When the coronavirus pandemic began early in 2020, experts predicted there may be waves of cases, a pattern that has been seen in other virus pandemics. Well, the second wave is truly here. Between December 2020 and January 2021, Africa has reported a 50% rise in COVID-19 infections. Nigeria had experienced a decline in COVID-19 infections in July and August 2020, but reported its highest number of infections on January 14th this year, with 2,877 infected. So, despite the initial successes in managing the pandemic, the virus is now spreading like never before and has become deadlier with more severe signs and symptoms. While there has been a rapid global research effort to provide long-term protection against the virus, the World Health Organization has warned that the coronavirus may never fully disappear. How prepared is Nigeria, with our arguably weak public health system, to navigate what may eventually be the new normal? What have we done between March 2020 and now to help us deal with the second wave? What lessons have we learned? Countries are rapidly vaccinating their citizens as an additional tool to contribute to the control of the pandemic. What is the status of Nigeria's vaccination bid? With an increase in infections within communities, experts say we must ensure the use of non-pharmaceutical control measures such as frequent hand washing. But how accessible is potable water in Nigeria? Today on Pivotal, I'm joined by Malam Suleiman Hussein Adamu, the Honorable Minister of Water Resources, Dr. Faisal Shuaib, the Executive Director of the National Primary Healthcare Development Agency, and Professor Oyewale Tomori, the Chairman of the Ministerial Expert Advisory Committee on COVID-19. Thank you, gentlemen, for joining us on Pivotal today. If I may start with you, Professor Tomori, in the 1 year since COVID came calling, have we actively put in place measures, in your view, to mitigate the impact of a second wave, which everyone knew was coming?
I think the basic information about the COVID, like anything, when we talk about mobile phone, the phone itself is not mobile. It's people that make it mobile. So also with the virus. The virus is an immobile thing, and it is people who are responsible for moving it from one place to another. So if government has put out the guidelines on how to stop it, wearing your mask, washing your hands, keeping safe distances, and the people have not abided by that, then the responsibility for the spread is more with the people than with the government. How will the government be able to enforce that is another issue. The ideal thing is persuasion, letting people know how important they are in the control of this disease, and then making them realize that they have the major responsibility to stop the spread of the disease. If government has done that and people have not abided, then government must find a way of persuading people. We've done it before, and Faisal will know that during the time when there was a boycott of polio vaccination, we took extra step of getting the community involved, getting them to be part of this situation, getting them to be the key role and players in this matter. So also I think we should have done and let people know that they are more important even than the government in stopping the spread of the disease.
There are people who feel that with the coming of this second wave, we need to take stringent measures of the like that we took at the beginning of the pandemic, which include close down, but that the government's softening of the policy because of the economic impact is ensuring that actually people cannot take this second wave seriously. Is this a valid criticism in your view, Dr. Faisal?
I wouldn't think that is a valid criticism because in the last 1 year or so of the pandemic, we've learned a lot of lessons. When we started out, there were a lot of things we didn't know about this novel virus. But in the course of the last few months, we've gotten a better handle of the characteristics of the pandemic and what it takes. What is very evident is the fact that the non-pharmaceutical interventions, public health measures do work. So what are these non-pharmaceutical interventions that work? Is the use of the face mask, social distancing, and hand hygiene, whether you do that by washing your hands or using sanitizers. What we've learned is that if you're able to implement these public health measures, then there's just an extra 5% or so that you gain by locking down communities and affecting livelihood. So on the balance, governments have to look at the actual effects of this lockdown on the economy and whether it makes more sense to be able to enforce the public health measures, such as ensuring that people wear their face masks, that avoid crowding of social gatherings and hand hygiene. What the data shows is that if you're able to implement this very effectively, then you probably do not need to lock down.
Let me ask the Honorable Minister of Water Resources what we've seen from March to date, that is March last year to date, regarding ensuring that communities get potable water. Has the ministry spent any resources and time trying to provide water for people who need it for hygiene purposes?
At the onset of this pandemic, around April, we in the Federal Ministry of Water Resources set up a national COVID-19 WASH response committee. WASH, of course, means water, sanitation, and hygiene, chaired by myself and with the commissioners responsible for water from the states as members. We've had a couple of meetings and through this interaction, trying to understand how each state was trying to cope with fighting the pandemic. We're able to draw up national guidelines on water, sanitation, and hygiene to fight the pandemic, which we shared with all the states. That is one. Secondly, under the presidential economic package that was put on, the 500 billion naira economic stimulus package set up by the president to support the economy in these hard times. We also made a proposal to the Ministry of Finance to the tune of about 10 billion, and we got the money. Using that money, we are now providing 10 schemes in each state of the Federation, water schemes in the most critical areas. So a total of 370 when you add with FCT. Then each state government, they have what we call state water agencies. We ask them what their requirements are. Some of them require lubricants or diesel or reagents or laboratory equipment. And each state has been allocated 10 million naira as an intervention by the federal government for that purpose. I think it must be understood, as I always like to say, that the primary responsibility of providing water and sanitation facilities for the people rests with the states and the local governments.
Let me bring in Dr. Faisal. Dr. Faisal, let me ask you this question, because we are now talking about vaccination, because we've seen other countries start to vaccinate their citizens. In Nigeria here, there's been a conversation about the country getting doses. We had an initial date of February. Now we hear maybe it is March. Can you confirm for a fact when Nigeria will get vaccines, where they are coming from, the doses that we're going to get, and what's the exact date that you expect to take delivery?
The space, the COVID-19 space, and particularly the COVID-19 vaccine production is an evolving space. So there are a lot of dynamism in terms of the ability of the pharmaceutical companies to meet with the demand. This is a situation where the demand for vaccine totally outstrips the ability of the pharmaceutical companies to manufacture. I'm sure you probably heard a few days ago that some of the developed countries in Europe and the United States actually threatened that they will take Pfizer to court over the non-availability of the vaccines, despite the contractual agreements that they were going to provide these vaccines. So that tells you a lot how difficult the space is. And because we're not a vaccine producing country, then of course we have to rely on the supplies from the global level. The COVAX facility is really a groundbreaking collaboration that is led by the World Health Organization, Gavi, the Alliance for Vaccines and Immunization, which is really working towards getting these vaccines, the COVID-19 vaccines, for low and middle income countries in a way that attempts to be equitable and fair. But of course, what we're seeing is that many low and middle income countries are left behind. We've seen significant delays in our ability to access these vaccines. I know that the COVAX facility is trying hard, but we're still at a point where we're still waiting.
Because of the fact that we've not seen COVID do the sort of damage it has done in other places like Europe and America, in places like Nigeria, there are those who are beginning to argue that our resources that we want to spend, almost $1 billion, I understand, on vaccines, would be better off spent on non-pharmaceutical interventions. So, for example, given the Honorable Minister a whole lot more money in order to ensure that people have potable water, other interventions at the primary healthcare level that will help, Nigerians be a little bit healthy. Honorable Minister, does this sound like something that you would welcome? Us taking money from vaccines and actually giving it to you to focus on providing water for Nigerians? Or do you believe that this approach that we have of trying to do both with limited resources is what is needed?
I think this pandemic can be fought by being self-disciplined and doing all the things that need to be done. But I think we're getting to a point where we're past the point where we say divert the money from vaccine to water. First of all, because thank God we have the vaccine. And if that is the quickest measure, so be it. We've been struggling in this country for several years. There is not a single city in this country that has pipe-borne water running 24 hours a day, 100% access to it. And it's not likely to happen in the next few years, regardless of how much money we put, especially if it's just money that is part of the money meant for vaccines. So what I would want to see is what we've been advocating since we came into office. We have the Sustainable Development Goals. We need to make sure that Nigerians have 100% coverage to 100% access to water supply by the year 2030. We must work towards that. And at the federal level, we've created so many initiatives. We've created the Partners for Expanded Water, Sanitation and Hygiene Program. We have launched the National Action Plan, and the president declared a state of emergency on water, sanitation, and hygiene way back in 2018, before COVID-19 came in. We have the National Roadmap to End Open Defecation by 2025. We have been trying so hard to get state governments to key in. Some have, many have not. And it is only if we have this political will on the part of state governments to invest more money into the sector, then whatever, if there's going to be a third or a fourth wave of the COVID pandemic, we'll be ready. But as long as it's always going to be just a fire brigade approach, then we're not going to get there. I would suggest that state governments learn a lesson from what has happened, understand that Water, sanitation, and hygiene are key to the well-being of the people, and to continue to invest on a regular basis. You don't do a one-off investment. Water, the issue of water supply and sanitation and hygiene, they are organic. Populations are rising, and so you have to keep pace with the rise in the population. You have to keep investing money. You have to keep sustaining what you have. And unless we continue to do that, then we're going to continue to have a problem.
Okay, we're going to have to take a quick break. And when we return, we focus a little bit more on the vaccination program of the federal government and get a handle on the mechanics. When will they get here? Who will get them? How are we going to prioritize? You're watching Pivotal. Don't go away. Welcome back. You are watching Pivotal, where I am in conversation with the Honorable Minister of Water Resources, Malam Suleiman Adamu, Dr. Faisal Shuaib, and Professor Oyewale Tomori, the Chairman, Ministerial Expert Advisory Committee on COVID-19. Thank you, gentlemen, for staying with this conversation. Can you talk to us about the improvements that have happened to the primary health care system since we saw the coming of the COVID pandemic? Because the assumption is that we would have done a lot of work to strengthen our healthcare systems.
We have to all recognize that in the last 1 year, we've been beset by the COVID-19 pandemic, and everybody was really focused on how to combat it with multiple lockdowns. But even within that period of the lockdown, we've been able to build the capacity of over 220 primary healthcare workers, making sure that they were capacitated enough to be able to communicate to community members about COVID-19. 220,000 primary healthcare workers. But beyond the training and building capacity of the primary healthcare workers, what we've also done is to do some infrastructural upgrades when it comes to the primary healthcare centers. Now, this is not in any way close to where we need to be. We've had over 2 to 3 decades where there's been underinvestment in primary healthcare. This is why Nigeria continues to have some of the worst maternal and child mortality indices globally. Nigeria now leads every single country globally when it comes to under 5 mortality. Now, these are very harrowing numbers that does not in any way align with our resources, be they material, financial, or human. This is why we're using this opportunity of COVID-19 vaccine delivery to strengthen the primary healthcare system. So what Mr. President has really approved is not just resources to procure vaccines, but also resources to deliver the vaccines to the last mile and also strengthen the health system.
So let me ask you to then speak to the modalities for the distribution of these vaccines, and in as short a way as possible. So when will they get here? How many doses are we getting? How will you distribute them? Who will get what? And how are you going to determine who gets the jabs?
Right now, we are expecting, as of the last communication from the COVAX facility, up to 16 million doses of the Oxford AstraZeneca type vaccine. The expectation is that these vaccines will come in the month of February. These vaccines will replace the originally communicated 100,000 doses of the Pfizer vaccine. We're also in conversations with the African Union. They have an African vaccine acquisition task team that has allocated 41 million doses of COVID-19 vaccines to Nigeria. These vaccines will be arriving between the end of March and April. Of course, with these numbers of these quantities of vaccines that we're expecting, which covers the AstraZeneca type, the Pfizer and the Johnson & Johnson, our hope is that we will work towards making sure that every eligible Nigerian gets the vaccine. We're going to be prioritizing our health workers, the frontline health workers, and those support staff that work with them, the cleaners, the sweepers. We're going to be prioritizing some of the strategic leadership, like Mr. President, the Vice President, leadership of the National Assembly, and also, key figures. We're also going to be prioritizing people who are 50 years and above. So people who are elderly, and then people who have underlying comorbidities. That is to say, people that have other diseases.
Let me bring in Professor Tomori here and ask him, sir, how confident are you of the checks and balances that have been put in place to ensure that the vaccination program doesn't go the way that normal Nigerian programs go, which is to be hijacked, corrupted, and essentially used for those who have money?
The plans are there. It is the people who will make the plans to work. The MPACD and the group have made their appropriate plans, taking into consideration all that can happen. But I think maybe what they have not taken into consideration is the behavior of the Nigerian. We are responsible for failure of many of the plans we have because we cut corners, and we will not take things the way they should be done. Already, there have been all sorts of stories going about who is going to be the first. People are already waiting to cut corners. Even as we are speaking, some of our rich people are already jumping out of the country to go and get vaccines in the place. So, Pfizer's group, they are doing their work. It is left for you and I as individual Nigerians to make sure that that plan is implemented properly by following the order in which they are put in there.
We've already started hearing about black market vaccines. On Twitter a few days ago, we saw people advertising jabs. And I don't know whether the Ministerial Advisory Committee is aware of the fact that people are already beginning to claim that they have vaccines for sale, and whether there's a plan to also deal with that particular danger.
We are aware of the unscrupulous nature of many Nigerians who are going around, bringing in all sorts of things. And that's where the law enforcement, the NAFDAC and other things, and that people should be aware that nothing that is not sanctioned by NAFDAC should be used by anybody.
Honorable Minister, we've heard Dr. Faisal there suggest that perhaps one of the people that will get the early jabs will be Mr. President. And indeed, we've heard the Christian Association of Nigeria urge him to be among the first to take the jab. I know that you know Mr. President well. Can you give us a rough idea of what his thoughts are regarding vaccines, and whether we are likely to see him in the front row of people who get a vaccine?
Absolutely. So I'm very, very sure that Mr. President will be number one on the queue to administer this, to get this vaccine administered on him, and to show the country, to give confidence to the country that all is well, that this vaccine is useful and acceptable, and people should embrace it.
Now, outside vaccines for COVID, as you know, Nigeria also tends to suffer from other diseases. And I remember the NCDC boss, Dr. Chikwe, warning us about the fact that while we are focused on COVID, we've seen the resurgence of Lassa fever, for example, and in some places, yellow fever. So what is the plan to ensure that in the process of battling these other diseases, Nigeria then doesn't fall victims to other problems?
What we've done is not to only focus on the vaccines, right? Not just in the procurement of the vaccine, but to also make sure that we strengthen the health system. So as part of that strengthening of the health system, we'll have to get additional human resources, because you are now asking health workers to go out there and vaccinate. They will not leave their routine jobs of treating for malaria, pneumonia, and then, giving counseling around nutrition, right? So the current crop of health workers are already, stretched because we don't have adequate numbers, especially at the primary healthcare level. So part of the budget that has been approved by Mr. President is to also bring in additional human resources. Those additional human resources are going to be there for the long term.
Okay. Now, let me give the final words to the Honorable Minister of Water Resources. Can I ask what you can predict regarding how quickly Nigeria will be able to tackle adequately the issue of, or the problem of a lack of potable drinking water for the population, especially since there's a correlation between public health and the availability of good water?
It's always amazes me when people I meet on the street that they don't have tap water in their house. They don't seem to understand that constitutionally it's the responsibility of states and local governments to provide the water. There are lots of projects that we have done only for the states to manage, but they are not being able to manage them. So we will continue to do what we can do, but we need strong investment, sustained investment. We have brought out so many measures. I've mentioned the Partnership for Expanding Water Supply, Sanitation and Hygiene Program, which we launched in 2016. We launched the National Wash Action Plan in 2018. The President declared a state of emergency on the water sector. But the response, where it should come, where the people are, is not as much as we would expect. And I'm sure Professor Tomori and the DG, the Primary Healthcare Commission, will agree with me that the basic problem is not the policies that are put out at federal level. It's always getting this thing strictly down to the states and local. That is where we always have the problem.
Let me just stop you here quickly and ask all three of you to respond to a final question. I'm listening carefully to you in this conversation, and again, the regular Nigerian seems to be blamed. The professor has blamed Nigerians, Dr. Shuaibu to a lesser extent, but he's also mentioned the role of people, and you also seem to be blaming Nigerians. No attempt at all to take responsibility for some of the government failures. That's what it sounds like. Is that what you're all doing, blaming people?
No, Nigeria is not a blame. We're extracting the situation. We're saying the situation as it is. We are Nigerians also. We are part of the problem. We accept. But that's the reality of the situation. So you have to define the problem, because before you can discuss the solution.
COVID is not going to kill my government. COVID is going to kill people and individuals. So you are the one that is more important. And therefore take that, that's what the point we're saying. Government can lay down the policy and all that, whatever it is they're doing. I mean, there are problems on both sides, but then the more important issue is me. Therefore, I should be more interested in doing what is right to make sure that COVID does not kill me. And that's the point we're saying.
I just want to reiterate the fact that COVID-19 is real, and that it is important for Nigerians to stick to the protocols, the guidelines, public health measures to ensure that they don't contract it, and that the vaccines that we're getting from our global resources are going to be safe and effective. And I'll encourage all Nigerians to access them when they become available. So thank you very much for this opportunity.
And that's it for today's edition of Pivotal. Thank you so much to the Honorable Minister of Water Resources, Malam Suleiman Adamu, Dr. Faisal Shuaib, Executive Director of the National Primary Healthcare Development Agency, and Professor Oyewale Tomori, the Chairman, Ministerial Expert Advisory Committee on COVID-19. Thank you for joining us on Pivotal.